Hi friends, welcome to my channel Optometry Online. The topic for today's video is about refractive errors. In this video, we'll learn about the basics of what is emmetropia, what is ametropia, and the treatment options. So, what is emmetropia? So, it is a condition where the eye is free of refractive errors. In order to have a very clear and crisp vision, we need to have the light exactly focused on the retina. So, in ideal emmetropic eye, the image from the object, light from the infinity from the object usually falls on the retina and we'll have a clear vision. So in order to have a clear vision, the light from the infinity, it has to pass through the two optical components, namely the cornea and the lens. The total optical power of the eye is 60 diopters, it is around average. So the 2/3 of vision contributed by the cornea and the 1/3 is by the lens inside the eye. So when the optical power of the eye is very high, it can cause myopic refractive correction. And when the optical power of the eye is lesser, it can cause hypermetropic correction. So there are few relationship between the ocular parameters and refraction. The first parameter is the length of the eye. When the length of the eye is on the higher side, it can usually cause myopic refractive error. And when the length of the eye is lesser, it can cause hypermetropic correction. And similarly, corneal curvature. So when the corneal curvature is very steep, it can cause myopia. And when the corneal curvature is flat, it can cause hypermetropia. The third factor is the index of the lens. In case of cataract, the refractive index of the lens changes. So accordingly, when the refractive index of the lens nucleus changes, it can cause myopia. And if the refractive index of the lens cortex changes, it can cause hypermetropia. So this is ametropia. So ametropia is a condition where there is some amount of refractive error, which can be classified as myopia, hypermetropia, and astigmatism. So what is myopia? So by definition, myopia is where a condition which the parallel rays of light from infinity comes to focus in front of the retina, accommodation at rest. So it is also called as short sight or nearsightedness. The symptoms usually they have a blurred vision for distance and a clear near vision, and they have headache and squeezing of eyes. So in this picture we see that the patient has got a very good near vision, whereas the vision for the distance is very blurred. So they tend to squeeze the eyes, to create a pinhole effect to compensate for the myopic refractive error, which can lead to headache and squeezing of eyes, and it also can cause squinting of eyes. So the optical correction of myopia is usually the concave lens. So in this picture, you see the light from the infinity comes to focus in front of the retina. So when you have to keep a concave lens, it makes the light to focus exactly on the retina, thereby giving a clear vision. Hypermetropia, by definition, it is the parallel rays of light comes to focus behind the eye with accommodation being at rest. So it is also called as far-sightedness or long sight. The symptoms of hypermetropia are blurred near vision, eye strain, headache. So in hypermetropia, since the image is falling behind the eye, the patient can use their own accommodative effort to compensate for the refractive error. So due to this constant accommodative effort, it can cause a blurred near vision and eye strain and headache. So it is usually corrected by the convex lens. So the optics of the hypermetropia is the light which is falling from the coming from the infinity falls behind the retina, and by keeping a convex lens, it makes us to fall on the retina, giving a clear vision. So third refractive error is astigmatism. So this occurs in asymmetric corneal curvature. Due to irregular curvature of the cornea, there's a irregular images is formed. We see a line image, line and distorted image even for a dot object. The symptoms of astigmatism are blurred distance and near vision. It can cause eye strain, headache, and squinting of eyes. The treatment is by the cylindrical lenses. So in astigmatism, we see due to different ray curvature, the light gets focused at two different positions in front of retina, in front or back. So we don't have a point focus, we have a line focus. And the optical correction is by giving a cylindrical lenses of varying curvatures, so that we make the light to focus exactly on the retina. The methods of correction are the conventional one are usually the glasses. The second one is contact lenses. When the patient doesn't have a feeling of cosmetically it is unacceptable, they can go in for a contact lenses. And the third option is a LASIK surgery, where some amount of corneal tissue is removed to compensate for the refractive errors. So we'll see in detail in our later videos. And if you like my channel, kindly like, share, and subscribe my channel. Thanks for watching.